and she has been distinguished with several prizes, including the Lola and Igo Fischer Prize from the National Autonomous University of Mexico, and also the Miguel Alemán Prize in Health Sciences for her achievements as a young investigator. So please welcome Dr. Espinosa.
Thank you very much, Selene, for the very nice presentation, and also for the opportunity to share with all of you what our institution did when all this pandemic started. And it is a pleasure for me to talk about the initiatives of many researchers. I cannot put all of them together, but yes, give you a brief general idea of what Cinvestav did when starting in that November, December, when the cases of a very strange pneumonia was reported in China. So thank you. I would say immediately, but putting together all the work that is now going to be described took some time. And these are not, as I said, all the works, all the projects that we have undergone as an institution, but our first idea was to put together our expertise in many different fields, in the fields that had the different researchers. I cannot put the next slide. Ahí está bien. Ah, pero no se ve, ¿sí? Ese se ve bien, sí, sí, está bien, está bien. ¿Sí? Okay. So, as I said, we put together, we are an institution that has many different interests, many different expertise of our researchers. So basically, we had some projects in education, in technology, some serological tests. Obviously, there was this group that was working on virus detection, medical support, basic research, because we have a huge area of basic research that I'm going to talk about, directly helping in the health institutions, and I will also talk a little bit about. And this is something very important, community information. There was this explosive fake news that we needed to combat with real data, with real information. So you can see that initiatives that were meant to get to the society were very important for us. In total, in this first cut, we achieved 81 initiatives that included 170 researchers, and obviously that multiplied by 2 or 3 students that were involved in the process. So I'm going to talk a little bit about each of the different initiatives. So obviously the virus detection was one of the big areas that needed to be needed to go forward. So basically the detection, making like easier diagnosis than the RT-PCR that was put forward by the World Health Organization was one of the problems that we had, because they were very expensive. They required so much equipment, they required specialized personnel, and so some of our researchers decided to do alternative diagnostic tests. And then these are quite here. And obviously the massive detection that was done here in Irapuato at Langevio, and that also helped, as we saw in the first talk, a lot with the genomic evolution of the virus. So a little bit about the home tests that were developed was this initiative by Dr. Beatriz Choconostle, in which she used RT lamp, this loop-mediated isothermal amplification using 2 enzymes. The idea behind this was that we only need one temperature to let the enzymes going, and that this could be done in the rural areas of our country. So she added a colorimetric dye that was changed, that changed color depending on the presence or not of the virus. And this initiative was certified by the Mexican Institute of Epidemiological Diagnosis and Reference, the INDRE. Then there was another initiative here from Langevio, from Dr. Luis Brieva, and he used the recombinase mediated exponential polymerization amplification, RPI, of nucleic acid. Here he is explaining it to several students, and he thought of this as a throat swab sample placed on a test strip that amplifies the DNA. The results were to be obtained in 30 minutes, and it needed 4 enzymatic components of the tests that were designed here at Langevio from genes of thermophilic bacteria. We shared his thought that this was an excellent method of detection. So in the molecular diagnosis that you already know, at first it was only to diagnose, and then it evolved into getting the whole sequence so that that Dr. Alfredo Herrera could find the details of the different variants over here of the virus. So those were the diagnostic methods that were developed here at the institution, but we also developed some serological tests. Basically, a very simple ELISA that sometimes going back to the simple ways is the best way to do it. Another was trying to see a microchip and the neutralizing antibodies that I will talk very briefly about this. I don't need to explain an ELISA, but only to tell that the antigen was the key of developing this method of serological detection, because it was homemade, because at that time, you remember, there was scarcity of all the materials that were needed to make more diagnostic tests. So Dr. Leopoldo Santos Argumedo with other in the group in Zacatenco in Mexico City, they just expressed the antigen in bacteria and were able to immobilize it and then continue into doing a very nice ELISA that was able to detect both IgM and IgG. And then the initiative of Dr. Jose Segovia from the Department of Physiology and Juan Ludert from Infectomic, they devised a way of finding neutralizing antibodies by expressing pseudotype lentiviral particles that had this decoration of spike proteins on top of it. And then having 293 T cells expressing the ACE2 receptor and putting them together. And then in those sera that were positive to IgG, they tested if there was a possibility to block infection or pseudo infection of these particles, and then see if these antibodies were neutralizing or not. And then there was another initiative by 2 doctors, but one of them is Gabriel Caballero from Cinvestav Monterrey, in which he tried to develop a high sensitivity serological test to detect IgG using a microfluidic device that they recently developed in the group. And they went forward, and they actually were able to do the test, and it was faster, had a much lower cost screening that requires very little equipment. And it was also a good way to use in mobile clinics for hard to reach region in Mexico. About basic research, there were many different initiatives, and not all of them are put here, but I will talk about two of them. That is the SARS-CoV-2 virome and its associated microbiome, and all those projects that were thought to be analyzed further by synchrotron light. So Dr. Angélica Cibrián, here also at Langevio, she decided to go forward and study the microbiome because we know that it induces immunity, and it can increase or not susceptibility to infection. And by crossing the data that were obtained with the clinical history of the patients, they were expecting to have a much more precise model to predict the evolution of disease. And the other were the projects that needed to be analyzed by synchrotron light, and these have very, very positive outcomes. Now is on route to be published in PNAS, some of these first two ones. And that is that what is the question was, what is the role of zinc as a cofactor in the ACE2 receptor union of the spike protein of SARS-CoV-2. And then they also were studying the effect of chloroquine and hydroxychloroquine on zinc storage. Basically on this part, they are very, this group is very interested in the role of metals in the enzymatic activities. And then another proposal was the structural studies of editosome of COVID in SARS-CoV-2 and the basis of flavivirus interaction with transport molecules. You can see that this is a big group that brought together these initiatives, and these ones were supported by, they financed by the government of Hidalgo, which if you were before here, I also thank the government of Guanajuato, but having the local governments involved really made a big difference. In health, I will also not talk about the many different parts of initiatives on health, but only on one, which is important, and that is the application of diagnostic tests. Now, we have a biosafety laboratory too in Zacatenco, and at that moment, applying diagnostic RT-PCR tests to different populations was really very important. First, it was the public sector with priority activities, like the National Guard. Cinvestav did a lot of tests for them, like federal ministry, like the Ministry of Education, the Ministry of Health, the Ministry of Foreign Relations, etc., which was also a very important way to help. Hospitals around the northern part of Mexico City, which is all these hospitals that were there. Essential personnel for private sector, basically pharmaceutical companies that needed to go on during the pandemic. We did some tests for them. And external, by external, it was meant either the Cinvestav community or the people that were around that could not find another way to have a test made. For the Cinvestav community, this laboratory has made right now over 10,000 tests. And we are very keen on how we have protected our community from infection, from inside infection. I am not mentioning here, but you also know that in Guanajuato, here Alfredo, with the collaboration of private companies and the local government, also prepared a huge setting to make tests available and to help in the pandemic. About education and community information that I told you was very, very important. Well, we have the communicating science. Many of our researchers went out in Facebook, made TikToks, went to Instagram, prepared webinars. We have a huge list of everything that they did to get right information to the public, to the society. And also we have Department of Education, of Educational Research, that brought forward some very interesting educational research that could help in this pandemic. And then finally, this group also helped the indigenous communities. Among other things, they published the general guidelines to protect from COVID in 7 different indigenous languages, which was the first flyers that really reached this community. Then a few things about technology also. I don't want to get very close to that part, but I want to talk a little bit about robot nurse and the mobility analysis and population dynamic and the contact alerts by an app that was developed in the Department of Computing. And this is the robot that was brought forward by the unit University UMA, by a unit that we have in Cinvestav Zacatenco that is collaborating with several universities in France. And it was supported by the Ministry of Science, Technology, and Innovation of Mexico City. Contact tracing is APLA-COVID. This is name is related to the Spanish aplacar, which means to get down, and aplacar COVID. So, and also APLA from application. And the group from the computing department at Cinvestav Zacatenco, these are the 3 main researchers involved, made this application that is available for Android and for iOS. And it's currently being tested in 6 hospitals and the periphery of the hospital in 3 and 4 different states. And then there is another group here from Cinvestav Irapuato, the genetic engineering department, Dr. Maribel Hernandez, who is using a geographic intelligence tool to map the movement of people around, which is will also help, or is also helping in trying to see, trying to prepare for the next pandemic, basically, with this initiative. Very briefly, I will talk about some small, very modest business initiatives that I think we can bring forward and increase with time. And that is Dr. Beatriz Choconosle prepared kits to extract RNA when the enzyme was lacking, when the enzyme was very, very scarce, and each kit contains 50 reactions, and it was distributed around so that the test did not stop. Here also a self-sampling kit for the detection of SARS-CoV-2 was developed by nasal swabs, and another one taken to take samples from saliva. The lamp test was also made into a kit, and here UV light was used, but later it was changed to the one I showed you before, in which the phenol red was changed in color because of the pH change. We needed to get all the funding we could, and we almost brought down the doors of all these institutions to help finance the different initiatives. And obviously the biggest strength that we have at Cinvestav is our people. So some of the things that I talked were made possible by these researchers and students. And thank you very much.
Much. Does anybody have any questions for Dr. Espinosa?
Thank you, Martha, and it's wonderful to be again here in Mexico and to be here at Cinvestav after a few years. It's not a question; it's just a dream that I had from the first time I visited Cinvestav. You know how we could get Cinvestav to be part of all Latin America, because we don't have these facilities anywhere else. I don't think even in Brazil or Argentina, and it would be wonderful if we could just be part of an international network like Cabana, but for the use of everybody. And you know, I know it's hard, but it would be great if different governments can fund some research at Cinvestav. I don't know how to do it, because you know, we can do it as scientists and get together in these small networks, but it will be like a major effort to do that. I just don't know how we could do it, but it will be the thing to do, because there's no point in trying to get any of these developments or equipments in every country, and we have tried, and there's no point. So it's just a dream that I still have of someday watching that in my life.
Well, I can tell you that we share this dream, and I am working, I am thinking, and I am sure that we will reach a point where we can do that in Latin America.
Okay, no, it's also, it's not a question, it's just a way to say thank you, because Maribel, for example, helped us in what you presented in analyzing the mobility in those times where Google couldn't just give you this kind of information. They help us with this information while we were helping the Cuernavaca city government, and unfortunately we couldn't publish this data. But it was really a nice effort that we couldn't have done without you. So that's also, something that we were collaborating, but unfortunately we couldn't, publish it. So, both, the National University and Cinvestav, could have some joint collaboration that would be very nice.
I'm sure it will continue to be like that. Thank you very much.
Thank you.